Chasing the Rainbows with your host, Bernice Quisenberry.
On this week's podcast episode, we are hosting our monthly segment of Ask a Maternal Fetal Medicine Doctor, and it's with Dr. Serena Wu, and she is a maternal fetal medicine specialist who experienced her own baby loss. We appreciate you being here and willing to give your time to fellow survivors.
Well, thank you for having me again. I really feel honored to be here with you today and to be able to help hopefully some survivors and some families out there who are going on their own journey to healing and peace and surviving. But thank you very much.
Right. Thank you so much, Serena. And, we just want to give a disclaimer here to say that we are not giving out medical advice. We are not medically treating any person, medically diagnosing any person, giving second opinions, virtual consults. We're not doing any of that throughout our entire podcast. This segment is to give some peace, like Dr. Serena just said, for our listeners who are struggling with some questions that have been lingering around their losses, but we are opening the ability to have a dialogue without feeling judged or silenced around our losses. And we are promoting awareness and actual feelings that occur during our losses for a safe space to talk about any thoughts openly and honestly. So for medical advice, treatment, or diagnosis, please consult with your primary physician or an obstetrician. Our intention is solely to help survivors process their own traumatic loss. We've received numerous requests from survivors through our criedoutloudpodcast.com website and are so grateful that we are being found. If someone is out there listening today and you have questions around your loss, please write in and we would love to help you in any way we can. With the volume of requests that we are getting, we could only select a few for this segment to highlight. However, be assured that we will be answering your questions. As we are working through and on this and the process of each segment, we may reach out by email for further questions and discussion. So this episode is going to address questions from two survivors, and we're going to address frequent concerns and questions that we have been receiving about the nuchal cord, or known as the umbilical cord, and it's being wrapped around the baby's neck. To start off the segment, I'm going to ask Serena some questions from Jill in New Jersey, who experienced a stillbirth. So her first question being, would cigarette residue on someone's clothing or on her husband's mouth play a role in this? And it's not that he smoked in front of her, it's just on him.
Well, as you know, secondhand smoke isn't ideal. However, having cigarette residue on the clothes, cigarette residue on her husband's mouth would not directly cause a stillbirth, no.
Okay, great. Thank you, Serena. Would being in a room with someone that is vaping nicotine cause this?
And again, I think that goes to secondhand exposure of a substance. But no, being in a room with someone vaping would not directly cause a stillbirth.
Okay. Did spraying Lysol, because of preventing colds and illnesses during, that time of year, could that have caused this?
Spraying Lysol should not directly cause a stillbirth. And that being said, I'm assuming that Jill did not spray Lysol daily and did not stand in front of the Lysol spray. Obviously, things that are done chronically and in excessive amounts are never good, but I'm sure that was not the case. So I'm assuming it was just a preventative measure that she was doing, and the exposure would not have led to this.
Okay, great. Thanks, Serena. Also, taking Claritin for bad allergies because sneezing and mucus, and having all of those issues, especially, pregnant, could that have caused this?
And again, I'm assuming that she took Claritin as needed for her allergies, that she did not take more than that was written on the box or bottle, and that if her symptoms were worse, she would have consulted a physician or her nurse practitioner or her provider. That being said, it is not directly linked to a stillbirth either.
Okay, thank you for that. Now, outside of those questions, just to wrap up Jill's final 2 questions that we have, we're also going to then tie in, and it's going to lead us into Brianna from Pennsylvania's questions as well. So we're going to spend the rest of the time going on with the nuchal cord, the baby's cord. So what is the nuchal cord, if you can explain that?
So I've always thought that medicine and our medical terminology makes things sound super scary, and I see many times my patients look at me like, what?
Yeah.
And a lot of these terminologies are very easily broken down. Nuchal comes from, I would have to really look it up, but it's the location of the cord, and it's around the neck. And the cord is referring to the umbilical cord. So nuchal cord is a cord that's around the neck, and it's the umbilical cord that's wrapped around the neck. Now, I've also heard a nuchal drape, and that to me, if you think about a scarf, I'm more of a visual person, and I think helping patients and families visualize what I'm actually seeing, maybe by ultrasound, or what I'm actually explaining, helps the families understand better what I'm trying to explain, versus listening to medical jargon and terminology.
Absolutely. I appreciate that. Yeah.
So if you think about the umbilical cord and think about when you wear a scarf, for example, in the wintertime, if you wrap that scarf around so that there's a portion that goes around the neck, so that's 1.5 times where the 2 ends are now in front and it's wrapped around your neck, that is a true nuchal cord. If you're wearing a scarf where it's just on your shoulders, but it's not wrapped once around your neck, I've heard the terminology called a nuchal drape because it's draping on your shoulders, but that is not a nuchal cord.
Okay. That's good to know. Thanks for that. I appreciate that description. So that leads us into then Jill's 2 questions. So is there anything to prevent the cord from wrapping around a baby's neck?
There is absolutely no way to prevent that. That baby inside, of course, we tell our moms to feel baby movement, and we want that baby to move as much as he or she does all day, all night. And there's no way to prevent the somersaulting that happens, the side to side that happens.
Right.
And there's no way to predict how long that umbilical cord may be. Some umbilical cords are longer, some umbilical cords are shorter. But there's nothing to prevent that cord from wrapping around like a scarf around the baby's neck. Okay. Unfortunately, I wish we could do something about it, but there's no way to tell that baby to stop moving.
Right. And we don't want that, obviously.
No.
So, yeah, absolutely. So additionally, though, what do you think is the cause of death of a nuchal cord?
So when people think, and I can see this, when people think of a nuchal cord and you think of something around your neck, you automatically go to, it's like a noose, and you think of lack of oxygen.
Yes.
And that's not the exact mechanism of a nuchal cord. And when you get that diagnosis that this possibly could be a cause of the cord around the baby's neck or a cord accident, and if that could possibly be the reason, it's not for lack of oxygen. It's actually the tightening and the constriction of the cord that then stops the blood flow to the baby.
Okay.
And that does lead then to a lack of oxygenation because the blood flow carries the oxygen to the baby to oxygenate the baby. If that cord around the neck gets tight to constrict it enough to stop the flow, that would be the mechanism.
Okay.
It's not the actual tight around the neck and then it cuts off the breathing because the baby's actually not really breathing in utero.
Right. Yeah. Yeah, because thinking about it, the baby's in fluid. Yeah, so that's their source. Okay, makes sense. Now, to wrap up Jill's question, then would sleeping on one side versus another cause the nuchal cord?
No.
Okay.
And actually, it's a very common question just in general.
Right.
Side sleeping. And many women come and ask that question and think that it's horrible to not sleep on your left side.
Yes.
I think it's out there. I actually haven't seen the many different sites that this information is on, but they come feeling horrible
Yes.
when they end up sleeping because they've always been a stomach sleeper.
Correct.
Or a back sleeper.
Yep.
And they come in thinking that they've done damage to their baby.
Yep.
And the truth is in the first 12 weeks, your uterus is not bigger than the size of your pelvis. Your pelvis is actually shielding that uterus and baby from anything. So whatever way you sleep in the first trimester is really not going to matter.
Okay. That's good to know.
Where this side sleeping actually comes into play is that the uterus naturally has a rightward tilt. And if you sleep on the left side, that tilt gets relieved a little bit. That rightward tilt, you have your major vessels in your body going, for your mom, going, so that's the aorta and the superior vena cava or inferior vena cava. These are big vessels that go down to your legs, brings blood down to your legs, brings blood back to your heart, and that compression of those vessels could invariably possibly lead to decreased blood flow to the uterus and therefore to the baby. Sleeping on your left side could relieve some of that compression of those blood vessels and possibly improve the blood flow to your baby and improve the oxygenation. But believe you me, sleeping on your belly, sleeping on your back is not going to prevent the baby from getting blood flow at all.
Okay, that's good to know because, like you said, being a back sleeper, being a stomach sleeper, you just naturally end up like that because you're exhausted when you're pregnant. And then, you wake up and you're like, oh my gosh, what's happening?
Right.
And then you go into
Right.
panic mode. So it's good to know that, Serena. I
Right.
appreciate that. Yeah.
And if the uterus was truly compressing all those blood vessels, I think the mom would feel it first because if there's a lack of blood flow to the lower extremities,
Oh, right.
I mean, you would have some issues there.
Yeah, your legs would fall asleep or Charlie horses and stuff like that, right?
Or start having lack of oxygenation, and
Right.
you might have some issues with poor circulation
Right.
in your legs.
Okay. That's good to know. Absolutely.
And I have to say, it's very hard to stay on your left side. You would have to barricade yourself in to keep yourself on your left side.
I know, because I was thinking like a body pillow, I guess, sleeping with those body pillows and just, creating it. But even so, I mean, especially when you're shifting around.
Right.
Can't control it. Yeah. Okay. Now, this leads us into Bree from Pennsylvania's questions. And real quick, I'm going to go into a little bit of background just to explain before we get into her questions. So when she was 18 weeks pregnant, she developed severe bronchitis, and she coughed frequently and forcefully for several weeks. And she was hesitant to take any medications to help with the coughing because she was pregnant. She was told that her extreme coughing would not affect the baby. But as they discovered that their little girl had lost her life at a routine ultrasound, when they delivered her, the cord was wrapped around her neck 3 times, which is why she passed away. So for her, they said the baby wouldn't be affected by the coughing, but she remembered coughing and feeling the baby flipping around a lot in her belly as she was going through those severe coughing spells. So her question really being like, is it possible that she josted around the baby so much and tangled the baby up in the cord from the coughing?
So that's a great question. And first, I would have to say to Bree that I'm very sorry for her loss. And it is hard to think that she didn't have, she didn't have something to do with what happened.
Right.
And in fact, as one plays and replays everything that you did in the pregnancy, you can't help but think was there something that could have been done to have prevented?
Right.
And I would say her doctor or her provider was right. The coughing, except for the fact that it affected her so much, and probably affected how she slept and how she felt, the coughing wouldn't have affected the baby.
Okay.
It would depend if the coughing was due to something, a virus that may have some effects to the baby. I mean, and that can be that's a whole different discussion.
Yes. Yeah.
But the coughing itself wouldn't have caused a nuchal cord, wouldn't have caused this cord accident to happen. And we can only conjecture that maybe with the coughing, maybe the baby was moving around a lot. But we can't specifically say that the coughing itself caused the nuchal cords to happen.
Right.
Unfortunately.
Okay. Yeah. If she would have had an ultrasound done during this time, could they have seen that the cord was wrapped around her neck? And is there anything that they could have done to unwrap the cord and ultimately prevent her death?
So having the umbilical cord wrapped around the neck 3 times, I would say that we could have seen it by ultrasound. Is there anything that we could have done to unwrap that cord? No.
Okay.
Unfortunately, there's nothing we could do to unwrap the cord. Just as there's nothing that she could have done to wrap the cord. There's nothing that we outside of the uterus could make that baby wrap that cord around the neck. There's nothing that can be done truly except for watching, and that is so hard that to do, because you're just waiting and you're
Right.
just watching. And so anecdotally, every provider is different, and I can only give my what I've done for patients when I've seen something like this is that I offer to watch them more often
Right.
by ultrasound. And I also advise the mom to do their kick counts. And if there's any time that the kick counts are not like the usual pattern, then I ask them to call in or I ask them to come in and be seen immediately. Now, depending on gestational age, like say if she's in her 3rd trimester and we saw something like this and there was something going on with all the fetal testing that we would do, depending on the where she is in pregnancy, we could go ahead with delivery. Or we could admit and watch, again, with ultrasound, as well as having the baby on continuous monitoring.
Right.
Because obviously in the end, we don't iatrogenically, which just is a fancy term for we are doing this to the mom. We are actively delivering the baby. Iatrogenically means we're doing something to do this versus we're not doing it ourselves. So I don't iatrogenically want to create a baby that's preterm.
Right.
But that may be what ends up happening is that if we see that the baby's not doing well inside and we're at, say, 34 weeks, we may have to recommend delivery, even though that's not what we want to do. But we can see on the different monitoring modalities that we have that may be the only thing left to do because, again, we can't unwrap the cord.
Right.
Now, if she was 20 weeks, there's really nothing to do.
Oh, yeah. So being that she was 18 weeks at this point, there's really nothing that could have been done to prevent it.
No, there's nothing that could be done to prevent it.
Yeah.
There could be ways to watch and observe and monitor.
Right.
But being where we're not at a stage where even if we delivered the baby, that baby wouldn't survive outside the uterus, we would not recommend a C-section at that time.
Right.
Or a vaginal delivery at that time.
Right. No, that makes sense. That does, Serena. Thank you so much for answering that. That's all the questions that we actually have from the nuchal cord, and from our 2 survivors, Bree and Jill from New Jersey. Well, Jill from New Jersey and Bree from Pennsylvania today. But listeners, like I said, whoever's listening, please write in at criedoutloudpodcast.com and we will get to your questions. And like we mentioned before, send follow-up emails if needed. But Serena, thank you so much for being here for this. And we can't thank you enough for taking your time.
And thank you so much for having me. Nuchal cords are such a frequent finding. It's generally an incidental finding. And that just means that we just find it happenstance. It is something that I could tell everybody that I hate talking about because it causes so much worry.
Oh, it does.
And half the time, nuchal cords aren't found, and the baby is born with a cord around the neck, or a cord around the body, or a cord around the leg, and you just don't pick it up on ultrasound. Ultrasound is not 100%, and that's unfortunately showing the limitations of ultrasound. But it is such a common topic, and it's such a frequent finding, and it makes you feel like, why can't we do something about it?
Right. Absolutely. I think, and especially where we're at today medically, you would hope that we could be so advanced that we could do something to prevent it or, but yeah, it's unfortunate.
So yeah, these are great questions that we had that was written in, and we definitely, Bernice and I wanted to address 2 very common scenarios as well as discuss nuchal cords, because frequently I find that when there's nothing wrong, families get an autopsy, families or get all the testing, and everything comes back negative or normal, and then they chalk it up to a cord accident, and that just seems so unsatisfying.
It does. It really, I can't imagine these survivors going through this and yeah.
Yeah, it's
Agreed.
really hard to have that as a final answer. And then you think, what do I do in my next pregnancy? What if this happens again?
Exactly. And hearing that, like we said, nothing to prevent it, or it's like, not doing one thing versus another and you just can't. It's like, it's so scary.
It's
the
definitely
unknown.
very scary. And so it is very important, I think, that in your next pregnancy that you get comfortable with your OBGYN or your family practice provider, and to have that person understand your concerns, so that if you're feeling decreased fetal movement or you're wanting that next ultrasound and you're asking, well, what about that cord? They will understand where it's coming from.
Yeah. And I think that is so important, opening that dialogue with your OB, like you said, or MFM and all of that, because I know with our pregnancy after loss, I did go in there pretty frequently and to get checked and things like that, because that gave me some peace of mind because we didn't have all of the answers around ours. So yeah, it would make sense. So I like that you said about having that openness with your provider. So important.
Yes,
Yeah.
it's very important.
Yeah. So thank you so much, Serena, for being here and for opening this dialogue up for our survivors and helping, them process what they're going through.
Thank you for having me.
Thank you. All right. Tune in next time, survivors.